This is being recorded, so we'll be able to share the recording with you if you jump off the call early or if you have somebody that you think could benefit. But this program, the topic is how has COVID-19 changed senior services? And we've got a great panel who you're going to meet here momentarily. But this program was organized by Lansdowne Heights Memory Care, Insight Memory Care, and Falcon's Landing, and I'm serving as the moderator. My name is Steve Gurney. I'm publisher of Positive Aging Sourcebook. Before we meet our panelists, let's go through some rules of the road that'll make your experience the best it can be today. First is chat. So I want you to think of chat as almost like a business card exchange if you were at a Chamber of Commerce event. That chat is a great area where you can communicate with the other attendees in the audience. And we have a wide variety of attendees today, ranging from senior serving professionals to older adults and caregivers. So this is a great opportunity to interact with each other. Now, real important is that when you're in the when you're in chat, you need to use the drop-down menu that says all panelists and attendees. So the if you just drop your chat message into chat and you don't pull that drop-down menu, then only the panelists are going to see it. So Katie from the option group, I just cut and pasted your introduction in there so that everybody can see that you're here and communicate with you. The next thing is we want this to be an interactive conversation. We want you to ask questions, make comments, what have you. There's two ways to do that. Raising your hand by clicking the button at the bottom of your screen, and then we'll bring you on audio. Don't worry, your hair and makeup doesn't need to be perfect today because we're only going to hear your voice. And or you can type in your question or comment into the Q&A box, and we'll make sure to get through all those. The next thing is, depending on how, actually, since we have a panel presentation, one of the recommendations that I might offer is to use speaker view, and you can toggle to that in your upper right-hand corner. In speaker view, you'll see the person who is speaking on larger on the screen, and as opposed to sort of the Brady Bunch with all of the panel members seen equally. Just to remind you guys, if you go to proaging.com, you can tap into lots of programs like this and other resources as well. Again, I'm with Sourcebook, and we just published a new DC Metro Sourcebook, of which Insight, Lansdowne, and Falcon's Landing are all included, along with hundreds of other providers. So if you want a copy of Sourcebook, just hit me up. But this is the topic that we have today, and let's get it started. So let me bring on our panel members. We have Anita Irwin, and with Insight, we have Justin Roberts with Lansdowne, and we have Paige David, who is on the phone from Falcon's Landing, and we have Steve M., who I'm thrilled to have because he is a caregiver and is going to share some of his insights. So let's see. Let me make sure that Steve and Paige are off mute. Can you guys say something to us?
Hi, everyone. This is Paige.
Okay,
and
great.
This is Steve. I hear you fine. Yep.
Awesome, great. And let's see. So let me stop sharing my screen here, and let's get to meet our panel members. Justin, I'm going to give you credit for bringing us all together here. You're from Lansdowne Heights Memory Care, and let's start with you first. Tell us a little bit about yourself, and tell us a little bit about Lansdowne Heights Memory Care. I think this is one of the, well, I know this is one of the newest communities in the DC metro region.
Yeah. Hey,
Steve, thanks for putting this all together. I really appreciate you taking the time, giving an opportunity to really share, I think, a lot of our success stories and what we've been going through. I think as a collective group, we've all, seen sort of the negative press that COVID has brought to senior housing over the last several months. But I think, hopefully today we can talk about a lot of the positive things that we've been doing over these last several months and, what the future holds for us in senior housing. But my name is Justin Roberts. I am the administrator of Lansdowne Heights Memory Care. We're about a stone's throw away from Inova Loudon Hospital right in Leesburg, Lansdowne, Virginia. I have been an administrator in senior housing for a little over 12 years now. Started my career as a caregiver and in senior housing and been able to work my way through ins and outs of healthcare in a lot of different avenues, and now have been running communities for about 12 years. A little bit about Lansdowne Heights. Go into that, sorry. A little bit about Lansdowne Heights. We are a all memory care, which means we do one thing, which is focus on seniors with a cognitive impairment. That is all we do here. So we really specialize in that. And we do that by really focusing on certified dementia caregivers here in the community, educating our family members and caregivers, and providing really quality care to our residents that live here, and trying to be those trendsetters here in the market.
Great. Now, Justin, the good thing is, since we've got a panel, if you don't mind, like your audio is breaking up, if you don't mind grabbing your cell phone and just calling in, I think that's going to be a better solution. And since we've got Steve and Paige on the phone as well, I think we're going to be able to hear you a little bit clearer. So if you can grab that panelist link and then try calling in, I'm going to mute your video here, and then let's see if that works better. And while you're doing that, we'll get to the other panel members. Okay, so next on the list here, and we've got her on the screen, is Anita Irwin with Insight Memory Care. Anita, tell us a little bit about your background and what Insight does.
So my name is Anita Irwin. I'm the executive director of Insight Memory Care Center, which is the only Alzheimer's dementia specific adult day center in the Washington, D.C. area. I ran memory care for 14 years before coming to Insight a year and a half ago. And so we serve folks from the very early stage of dementia all the way to the end stage of dementia. And through this COVID crisis, we've had to pivot virtually, and now we are serving participants in person as well. But our systems and our policies have surely changed through this crazy time for sure.
Yeah, and I really feel both of the families that both you and Justin's community is serving, families that are impacted with loved ones with memory care, I feel have been hit harder than anyone else through this pandemic. It's my heart just goes out, but it's, as we're going to talk about today, there's some creative solutions, and we need to be thinking about the future and how we can better serve families. So thank you, Anita. And then on the phone, we have Paige David with Falcon's Landing. Paige, you want to share with us a little bit about yourself and Falcon's Landing, which is a really unique campus that you have there with Falcon's Landing.
Thank you so much for having me. My name is Paige David. I'm the current administrator for Westfall Center. It's an assisted living, one of the assisted livings of Falcon's Landing, which is a continuing care community. I've been in the healthcare field in various settings for about 10 years. Started in health information management, moved into laboratory setting, and for the past 4 years, I've been with Falcon's Landing in multiple capacities, but most recently as an administrator in their assisted living.
Great. Thanks a lot. And for those of you that might be in the audience that are not familiar with some of these terms, that continuing care retirement communities, or life plan communities as they're starting to be called, combine independent, assisted, and nursing all on one campus. And the concept is that somebody can move in while they're independent, be cared for through their entire life. But campuses like Falcon's Landing, an individual can, if there's space available, you know, can move in right to assisted or nursing or as needed. Our final panel member that I'm real excited to have is Steve M. And I'm intentionally not using his last name because he's going to be sharing his family's experience and would like some privacy for his parents. But Steve, do we still have you on the phone, correct?
I'm still here, yes.
Great. Well, let's kind of kick this discussion off with you sort of sharing a little bit about your current situation and what went on in the COVID crisis.
Yeah, well, my dad is at Falcon's Landing. He has dementia. He is in an assisted living building on their campus, and really should be in the memory care unit, but because of COVID right now, we're hesitating to move him there at the moment. He is with a caregiver 24/7, which in itself causes some stress because that's more people that are seeing him each day. But back in March, we decided to pull him out of assisted living for 4 months, from March till July. We actually didn't think it was going to be that long that he would be out of assisted living. We thought that this crisis might be resolved a little sooner and that we'd be able to bring him back maybe May, maybe June. But we pulled him out in March when we were seeing the headlines on the news that were quite scary. There's the nursing home many people may have heard about in the Seattle area, which probably got the first attention. And then nursing homes here in this area were starting to get cases and worse. And we saw that staff at these facilities, the one in Seattle comes to mind, although deeply cared for their residents, did not seem to be prepared to handle this or be prepared for it. There were stories of nurses in tears telling how they gave their residents comfort by hugging them, which is sounds nice, but it also is probably contributing to the spread of the disease. So we debated, my sister, myself, and my nephew debated for weeks whether to bring him out. We had been isolating, and we were confident we were not going to pass any problems to him, to my dad. We were more worried initially that we would be bringing the virus back here. We thought that him in the assisted living facility was not so much a question of if he would catch it, but when. We were also very concerned about the isolation. We had been visiting him up to 4 or 5 times a week, short visits in the evening. And we also were going out to dinner with him on a weekly basis. So we worried about the isolation. If he came home, and he often talked about wanting to come home, if he came home, he'd have engagement from people who knew of his past, that could talk about his interests. And there'd also be 2 cats running around, which, can, for him, does wonders. And we debated, and our biggest concern was my nephew. We decided, since he was the youngest and healthiest, he would be with my dad for the first 2 weeks that my dad came home. I have an underlying condition where I could not have been around him if he was testing positive. There was, again, debate. We didn't know should we risk my nephew's health or not. He was all gung-ho for it, but he's 20 whatever, and didn't know if he was thinking through everything. So we brought him home. And another reason we were able to do this is that I'm working part-time and can do that remotely. My nephew is going to college, and his classes became remote. My sister was about to start a new job in March, and her hiring got frozen until this crisis got passed. So we quarantined for 2 weeks beforehand, and we did. Since not only does he have dementia, he uses a walker. We moved all the furniture to the perimeter of the room. The house he was going to is the one he had lived in. It already had stair lifts. We had a bathroom off of the room he'd be staying in, off of the family room. Unfortunately, it's not ADA compliant, so getting in and out is a little bit of a struggle. We were worried about him heading out the front door, so we put some barricades up. We barricaded the door to the basement. We already had a lot of the gear, thermometers. We had blood pressure gauges. We stocked up on latex gloves and hand sanitizer, and we put rules in place. Every time you came in the house, you had to use hand sanitizer if you came in from outside. Steve, if I'm going into too much detail, let me know.
Oh, no, this is, I thank you so much. You are telling a story that I know everybody in the audience can relate to. And I'd like to back up a little bit though. Can you, let's back up to prior to COVID and tell us a little bit about what led to Dad moving to an assisted living community in the first place, pre-COVID. What kind of led up to that?
Yeah, it's kind of unfortunate. He had been living at home, independent, still driving. And in the fall of 2017, he took a tumble on the front porch. He would go outside to feed a stray cat every morning. And he took a tumble and broke bones where his leg and hip meet. And he seemed to be fine. He was joking with the paramedics when they came. He went to the hospital, and between the pain relievers and the anesthesia, or both, his memory got clobbered. He's not been the same since. Now, in hindsight, I was seeing changes in his personality prior to his tumble. So I'm guessing that this fall and the anesthesia and the medications didn't cause anything, but it sure accelerated it. And he's been a different person ever since. So he initially was at a nursing rehab facility, another one here in Northern Virginia. We moved him to Falcon's Landing because we had some we weren't completely comfortable with the first place. Their attention to detail was not what we were looking for. We got a tour of Falcon's Landing. We liked it a lot much. Plus the residents there, many of them share his background. It has a lot of ex-military at Falcon's Landing, and we thought he'd be able to interact better with the residents there. So after a stay in the nursing facility, also at Falcon's Landing, he moved into the assisted living facility, and was doing pretty good for about a year, and then he's gradually been declining a bit memory-wise. And I mentioned earlier he probably should be in the memory care unit. We just hesitate to move him without my sister and myself and other relatives there to assist him. We're concerned about the transition. So we've decided to leave him in familiar surroundings for the time being.
Okay, thank you for that background. And so I know I interrupted your story, but it sounds like, so COVID hits, you bring dad back to the home. Sounds like you took every possible precaution and you're pretty well equipped for that. But I think sort of where we're going with this is that he's now back in at Falcon's Landing. Am I correct?
That's correct, yes.
Now, what led to that decision?
Well, taking care of someone with dementia is tough. We knew it'd be hard. We didn't know it would be as hard as it was. It turned out to be a 24-hour-a-day job. And between me and my nephew, I moved into the house. So it's my nephew and myself are living there, taking care of my dad. And we're doing all the cooking. We're doing all the laundry. He has prostate issues, so there's no 8 hours of sleep. I was up basically all night. My nephew would be up all day doing the shifts. And my sister was running the errands for us. She would be bringing us groceries and running errands for us. And we were wearing out. And about that time, this was in July, it seemed like things were getting in control. Falcon's Landing was putting out a regular notice about the status and indicating that how many people were being quarantined, and the numbers were getting lower. And then they put out a notice saying they were allowing residents to leave the facility for doctor's appointments. And we thought, okay, this may be an opportunity to bring him back. Again, we were running out, and also with elderly especially, problems cascade. He took a tumble out of his bed one night, and he's on blood thinner. We're really worried. We're looking for bruising. We're checking for bruising. He seemed to be fine, but after a few days, a bruise developed, and it didn't go away. And it turned out he had a microfracture in his tailbone in the fall. Nothing to do with the bruising. The bruising turned out to be okay. This is a different problem. And because of this, he was not comfortable sleeping in a bed. So he started sleeping in a recliner, but he didn't want to recline because that was getting uncomfortable. So now his feet are starting to swell, and we couldn't get the swelling down. And these problems are just cascading. And by the way, we took him to the ER. That's how we found out about the microfracture. So we're now getting in over our heads in terms of what can we do medically? We're putting ice packs on his feet. We can't get the swelling down. And we thought, okay, let's check with Falcon's Landing, see if we can bring him back. And those are the two things. We were wearing out, and he needed medical attention that we weren't able to give him.
Man, wow. I really, really appreciate you sharing this story. And I know this is something that folks, the journey that you're going on is very unique and very challenging to your family, but it's a familiar one for many people these days. And Steve, if I want to get to some of our other panel members, but you've really set the table for us nicely. And let me start with Paige David at Falcons, because that's where your dad is. And Paige, is there anything that you'd like to add in terms of the challenges that you and your team went through in COVID, and in sort of making it a safe and comfortable place for your residents?
Sure. I mean, I think I can speak for everyone here when I say that we all had hoped that at the beginning of this, we wouldn't reach our facility, but it was kind of inevitable. There were rising cases in surrounding states, and there was just a lot of unknown to it. And there were a lot of challenges in the beginning. And one in particular is mitigating the outbreak once it got to Falcon's Landing, because, we have two healthcare units, one with both assisted living, a temporary memory care, and a nursing, and our standalone West Falls assisted living. But mitigating the outbreak in the beginning was one of the biggest challenges. We had to really implement a strict infection control protocol. And those have changed constantly because we were getting different guidelines from CDC, our state and local health departments. Also, in the beginning of COVID, we needed to open channels to different vendors so we can get the adequate PPE, protective equipment. And one of the other challenges that we faced was, like he mentioned, the resident isolation, because, we all know that social interaction in senior living is so vital to their way of life, quality of life. And in the beginning of this, where we had to restrict all communal gathering, restrict visitation, it was very challenging. And we saw the toll it did on not just staff, but most importantly, the residents. But like I said, there was just a lot of factors, a lot of unknowns, and constantly changing protocols and procedures that we had to navigate through and be able to transparently communicate to families.
Yeah, when all of this started happening, I was blown away at how transparent Falcon's Landing was about the situation on your campus. But one of the values of an organization being transparent is the amount of community support that Falcon's Landing received from the community. It was really heartwarming to see that. And I think a lot of those West Coast nursing homes that got hit by this first, that tried to keep it under wraps, they paid a big price.
Oh, absolutely. I mean, we were fortunate enough that we have the unwavering support and trust of all residents and families for the most part. Now that we're beginning to get into this new normal of social distancing, for the most part, residents are compliant, and our staff have proven to be resilient to the changes, resilient to the outbreak. And I think in the future, we're better equipped to deal with an outbreak if it does so happen again, because we're just more informed. And like you said, the support of the community, not just families, other businesses around the area have been very, very supportive.
Great. Well, thank you. And I'm sure we'll come back to you. And I want to remind the audience that if you have questions for anybody on the panel or comments that you would like to make, either type them in or raise your hand and we can address those in this discussion. Okay, so Steve sort of set the table for us with this just, again, heart-wrenching journey that his family went through, where dad had a fall. Most people enter the elder care system because they were healthy one day, they fell, and all of a sudden their independence is compromised. And, they moved him to an assisted living where he's cared for, starts having some memory care impairments, COVID hits. It's sort of like, we got to get dad out of there. But now experiencing what it's like to be a full-time caregiver for somebody with memory impairment, I'd like to jump to Anita next, and then we'll get to Justin. But Anita, adult daycare historically has been this respite for families like Steve, who are caring for a loved one at home, where you can get a break because, dad goes to adult daycare for a certain amount of hours during the week. COVID hits, and holy cow, what happened with Insight and your families?
So we realized early on, pretty quickly, that we had to pivot all of our services. So we increased the amount of support groups that we were doing virtually because families needed them. The amount of their stress went from 0 to 1,000 in a hot minute, exactly what the family member was talking about, the 24/7 piece, the no break, people not sleeping at night. How do I manage this? This was respite care. How do I put systems in place, and how do I ensure that I'm meeting we transitioned all of our been doing support groups and continue to do support groups virtually. We then transitioned a lot of our programs virtually, so we were at least giving the family members a couple hours break with our higher participants on a Zoom call, doing activities with them, actively engage with them to give them a break in that regards. And then they needed help, and we heard it. And I can I can attest to exactly where this family member is. My dad's been diagnosed in the last 2 months with Alzheimer's himself, and so as a professional, as a family member, it's a totally different thing. And so to watch this from a family member perspective as well as professional perspective, it's very different. So we put our protocols in place. We had VDH come out. We submitted everything to them and said, this is what we want to do. This is what we think is going to work. And I'm going to say that I have some amazing staff, and our families have been outstanding. We have opened our doors since the end of June, and we have been successful up until this point, serving 24 participants per day to give families that respite. But the amount of people that we have seen from the times that we shut our door to when we opened it, from that placed in a center or needed additional support, was astronomical. Some of our highest functioning participants, the social isolation, the lack of engagement, the lack of structure, definitely increased the dementia to a point where families were like, this has gone from 0 to 100 in a hot minute, and I need help. And so the amount of placements that we've seen, the amount of decline that we've seen in our participants has been absolutely heart-wrenching.
Man, well, thank you, and for sharing that. And it's great to hear that you're able to open. You know, in some states around the country, adult daycares are still not allowed to open based on the state regulations, and which is good. But this is a situation where, you know, if a provider can get creative, address the social distancing, have all the precautions in place, and give families some very valuable needed respite, it can really make a difference. So thanks, Anita.
Yeah, I mean, I think our biggest challenge,
Whoops.
Go ahead, Steve.
Oh, no. Tell us your biggest challenge.
Our biggest challenge has been obviously the masks, and consistently. And then we obviously set up the room to where our seats are 10 feet apart. They're not 6, but they're 10 feet apart, to make sure that we're managing that social distancing piece and what have you. And then, you know, masks are hard. They're hard enough for you and I, let alone somebody with dementia. So understanding that they need mask breaks and taking them outside and allowing them to take those masks off for short walks and things like that, to be able to manage that piece of it. That's been the biggest challenge.
Yeah. Oh, absolutely. I'm going to jump to you, Justin, but before I do, I want to follow up with Steve. Steve, out of curiosity, have you been involved in any support groups? Anita brought up the support groups. I was wondering, is that something that you and your family were able to participate in at any point in your journey?
No, and it's something we didn't even think about, but it is something I'm going to look into.
Yeah, you know, this is Steve and his family really illustrate just such a typical story. There are so many resources out there for people to tap into, but it's overwhelming and you're stressed and you don't know where to turn. And that's why I'm glad that we're able to provide this forum, because if we can educate one family member or one individual about a resource that they didn't know about, it can change people's lives. So thank you, Anita, for bringing up support groups, and that's great. So let's jump to Justin. Justin, you're with a memory care specific community in Northern Virginia, Lansdowne Heights. And I think with the two stories that we just heard about the challenges of people caring for somebody with cognitive impairment at home, as much as we all prefer to age in place, we know those statistics. This is one population where it can be so challenging for a spouse or a family member to take care of somebody with memory impairment. There is tremendous value in making a move. And I think that, you know, can you share with us some of the steps that Lansdowne Heights has taken to give people confidence that they can make a move in this COVID-19 world?
Sure. And hopefully my audio is working better this time. I'm on the phone, but also 1,000 times better. Perfect. Yeah, just hearing that story, it's definitely something that we talk about here every single day. And you know, what we're trying to accomplish is, you know, getting the word out there that even through this crisis, the changes that we've made in senior housing over the course of the last several months, there's still so many benefits from being in an environment that you can get the socialization, you can get the attention to detail, you can get that transparency that you receive in a community such as Lansdowne, or even the adult day cares, as you touched on. So, you know, originally we were going to open, Steve, right in the heart of this. So we were scheduled to open here in mid-April of this year, and when everything started to take sort of that turn, we just decided to delay a few weeks, really to focus on our policies and procedures, staffing. How are we going to address this if we do have a resident that becomes positive or comes to us and positive, or a staff member? Also educating staff on making smart decisions and choices. I think that's a big part of what we're currently doing, what we did at the beginning. And then finally, you know, securing a lot of those PPEs that we've all just touched on, so that we can adequately take care of these residents that are coming in here, and making sure that my team here is in a safe environment, as well as the residents in addition to that. Because we were able to take that additional time, we really focused on trying to be that trendsetter. So we sat there and listened to family members and took into account sort of what they wanted from us, you know, as we open, as far as communication, as far as visitation and things like that. And now we're doing quite a few things, such as daily screening of not only our team members, but visitors and professionals that are coming inside of the community. We're also testing our staff twice a month, really to have more of a stopgap, you know, to have an understanding that hopefully our team's making those great decisions and choices on their off time. But in the event that unfortunately they do test positive, I have the ability to make some quick changes twice a month with my staffing, so that it'll lessen the likelihood of the spread throughout my community. And then, you know, also opening up to family visitation is what we were able to do really right off the bat, right after we opened, a few weeks after we started with outside visits. But this crisis has really opened up our eyes to really looking at different parts of the community and how we can better utilize spaces that we potentially might not have used in other ways. And so now we're have the ability to have family members come in, spend a short period of time with their loved one in a secure safe environment, and so that they can have that touch, that feel, that face-to-face communication rather than, I think as we all started doing those window visits and things like that. So that's sort of where we are right now, and what we're doing inside of the community. And hopefully over the course of the next several weeks, as we get more of a grip on, what are some good decisions, we'll be able to open up the building even more in a limited basis. But the goal, honestly, for me is I never want to tell somebody, no, they can never see their loved one again. I think as healthcare professionals, it's our obligation to really come up with unique and innovative ways to continue to provide a high quality of care and be transparent as possible. And having these visits indoors, I think, has taken a lot of the burden off of the family members. It's not you're dropping your loved one off and see you later next month or a year from now. They're really able to still come and see, and we can provide that space for them here.
Thanks, Justin. And while you were talking, a question came in from Rachel Manis that was wondering what aspects of initial residence assessments have changed due to COVID-19. So, when you're bringing in a new resident, what are some of the steps that are taken before somebody can move into your community?
Yes. The biggest change I think that we've seen, and Anita touched on it earlier, is technology and healthcare and how we're utilizing that. So that's been a big change for us. I'm currently in our telemedicine room, if you will, using our camera that in the event that we did need to have a physician visit and that couldn't make it inside of the community, we can use some of these spaces in a way that we can still get that professional touch and access to physicians and doctors and things like that in this particular space that we have. But that even went a step further with a lot of the skilled nursing communities restricting some visitations, and rightfully so. We're having to do Zoom calls such as this to do at least a hands-on or once-over physical assessment of a resident. Has helped at least get us a little bit of a background. But we've also leaned a lot more on those family members that are moving and trusting us to move their loved ones in here to get that physical, that history of what's been going on. We currently are testing all of our residents prior to moving in the community. They do need to become with a negative COVID test within 48 hours of moving into the community. And then once they move into the community, we are having a more of a socially distanced section of the community here. So they're in a part of the community where they're still able to roam and have access to our dining room and programming and things like that. But they're in that section for a short period of time. Right now, we're still looking at 2 weeks until they move into their permanent apartment in our other portion of our community.
Great. Wow, that gives a great overview. And then Rachel was curious also about, once they're part of the community, participating in activities, using the salon, podiatry, things of that nature. I'm assuming that that's all very structured, as unlike it was before COVID.
Yes, I mean, the screening process for all of our visitors and professionals has definitely ramped up more so since COVID, which is always a positive. But our residents still have access to programming. As Anita touched on, I think our biggest challenge in memory care is getting the residents used to wearing masks throughout the day. It's a challenge, as she said, for all of us to wear it in our own day-to-day lives. But a person with a cognitive impairment, it creates a little bit more of a challenge. But we've already opened up for communal dining and distance our residents in that aspect. Salon services are now involved. We are having visits from our stylists here inside of the community. and making sure that they are testing on a frequent basis. And that's more my comfort level. Each community for senior housing, I should say assisted living, really has their ability to do as they feel comfortable. We really don't have a lot of mandates for assisted living. Skilled nursing is on a different sort of path than we are, but because I have a newer community, it's given us the ability to open up a little bit sooner than I think some of the communities that have been open a little bit longer and are dealing with different challenges than I am.
Yeah, you've got the benefit of having more space and able to naturally social distance. Well, let me jump back to Paige. Paige, do you want to kind of share, kind of feed off some of the dialogue that we just had with Justin on anything that folks should know about what's going on in your community in terms of the protocols and safety and things of that nature?
Sure, of course. Right now, we started limited visitation. We do have certain requirements that it's only going to be a one-time visit at this time because, we have our nursing unit. We have all these healthcare units in our community, and we're all one. So we all kind of is umbrellaed into one procedure and protocol. So we do require testing of a family member or their power of attorney 7 days before scheduling a visit. And it's a 30-minute visit. Weather permitting, it would be outside, but if not, we do have designated areas within the facility. That way we can control disinfecting it. Our salon services have resumed. It's actually started a few months ago. All those stylists are being tested regularly within the facility, and we've partnered with a couple laboratories in the area that does provide us consistently with kits. That way we're able to do testing, both residents and staff. At one point we were testing residents and staff twice a week, especially in our nursing unit, but we have now kind of leaned towards weekly and monthly for assisted living. We've also started some activities, social distance. We've opened our dining services, but residents still do have the option for meal deliveries. We're doing 2 seatings to make sure their residents are 10 feet apart during dining services. And that's just enhanced protocols. But I mean, there's a lot of still work to be done. I mean, there's a lot of still unknown, and hopefully we're just doing the best we can to prevent any other outbreaks in the community.
Great. I'm going to get to Anita here shortly, but Steve, again, your family's story of, having your dad in assisted living, then dealing with the challenges of being an in-home caregiver and realizing, okay, we got to get dad back to a safe place with medical professionals on hand to address this. One of the things that you're missing is now you're not interacting with dad on a daily basis. And as we just heard, all communities, it's no longer just sort of like, oh, I'm going to pop by and say hi to dad, walk down the hallway, talk to about 5 other residents too. It's a structured system no matter where you are. How has that been going, the communication with your father now that he's not living in your home again?
We have daily phone calls. We've not visited him since he went back. We have daily phone calls with him multiple times a day.
And given that he's, has some cognitive impairment, how has that gone? And have you tried any like FaceTime or any of that technology?
We've not tried FaceTime. It's all been, he's comfortable using the dial phone. We think we would have difficulty with the FaceTime. He does have a sitter with him, a caregiver with him 24/7, an external company has provided sitters. It's possible they may be able to help them with that. But we've stuck to the regular dial-up for now.
Yeah, I mean, as we're all dealing, everybody's family is different, and familiarity, especially with somebody with cognitive impairment, is one of the consistent themes that I've heard over the years. So, well, thanks for sharing that. And then we've got Anita back. Anita, anything to add? It sounds like, some of the questions are, related around, what does it take if there's somebody out there that is in need of Insight Memory Care? What does that process look like to become a participant in the program?
So what we're requiring for any new participants that are interested in the Insight Memory Care Center is that they quarantine for 14 days. We ask for 14 days worth of temperatures. We do ask for a negative COVID test the week prior to coming into the day center. We can do the intake virtually, and we can help get doctor paperwork and what have you virtually. Between time, if a family is in need of some respite until we can actually get them in the day center, we can sign them up for our virtual programs as well. So we have a number of different spokes of our center that we can kind of plug people into and make sure that they're getting the support and help that they need. Okay, great. Yeah, and I guess the challenge that you're faced with is now, because your capacity is lower, the amount of people that you can include, staff and resident and members, and the demand is increasing. It's a supply and demand challenge that you're faced with now, correct? Correct. We're also looking at starting our early stage program, Reconnections, out in Loudoun County, and that's going to be a virtual program. So if people are in the early stage and able to write and read still, we are looking for participants. It's 1 day a week for 1 hour. It'll be virtual. We can definitely hook them up to make sure that they're getting some type of engagement with that as well, and get them plugged into that service. But I think more importantly, we do free consultations. If anybody has any need, all they have to do is either reach out via email, phone, or what have you, and we're happy to try to assist in shape or form. It doesn't matter if your loved one's placed in a community or at home, where it is. We want to make sure that people are getting a holistic approach that they need during this pandemic, the maze of dementia. Great. Thank you. We're getting close to the clock striking 1. So I want to sort of put a call out for anybody that has questions, comments, things that they would like to share here. Oftentimes, once I get ready to close these sessions, that's when all the questions come in. But I want to share a comment that Patricia Henry shared in the chat, and it's that it has been stressful. This is when we were talking about caring for somebody. Who do I go to out of all that is offered? It's hard to choose the right organization or persons you need to talk to for help. And this is, again, a common theme that we hear. One of the good things about a program like this is that you see that you don't have to walk this road alone, is that there are providers out there, and everybody in this field is willing to help, even if the ultimate choice isn't the solution that they're providing. There's a lot of collaboration, as Anita had just sort of shared. Is somebody can't get into her program, then they've got other options. One of the things that I highly recommend is, if it's possible, is when you're talking to providers, is to see if you can connect with other families that are just like you, that are already utilizing that provider. People like Steve, and and I saw a comment here from Jennifer, whose mom is at Lansdowne Heights. Oftentimes there's no better person to talk to than somebody who's walked
a similar path as you to give you confidence in the provider or the organization that you're choosing. So hopefully that can be valuable. Let's see, guys, we got 5 minutes. So what I'm going to do is just kind of go around our panel, and if you've got sort of some closing remarks or words of wisdom to other folks that might be out there in the same shoes. And I really want to start with Steve, because Steve, your insights have been so valuable today in our discussion. Steve, any sort of words of wisdom or for other folks that may be facing similar challenges that you and your family have been facing?
Well, we did it because we were in a position to be able to do it. I think a lot of people would like to do it, but aren't able to. We had, the three of us had time where we could spend, so we were able to do it, and so we feel fortunate in that. Again, it's something, it was tough, but we don't regret doing it at all. There were moments where he was his old self, and we'll remember those. Looking at old photo albums and things like that. So again, we no regrets. If I had to do it over again, knowing what I know now, I think we would have done more to try and recruit more help. But you know, we didn't know who might be infected, who might not be, and so there was that worry. So there were no regrets. Words of wisdom, I don't know that I have any. Everyone's situation is probably going to be unique.
Yeah. Well, thank you so much for sharing. It's you've really added a dynamic to this conversation that I think all of us have walked away with some a better picture of what the world is like for a family. So thank you. And Paige, do you have anything that you'd like to add in sort of closing with our discussion today?
Sure. I just want to thank everyone first for, giving us the opportunity to share our stories and what our facilities and communities have gone through. I think the past 8 months have just shown our commitment to enhancing senior living, not just for communities, but other families, making sure they're in the right setting. And, we're just fortunate and thankful that we have the support and confidence of residents and family members, that we're here to help, that they're trusting us to keep their loved ones safe.
Great, thank you. And then Anita, if you want to some remarks, and then we'll finish with Justin, who brought us all together here, and we'll close things out.
I want to absolutely thank Justin for bringing us together. I think the family member story has brought a clear light to how we come together as healthcare providers to be able to try to support our families. And so if anybody needs anything, to reach out. It doesn't mean that you're not doing a great job. And even if you think your loved one is in the right place, if you're struggling with self-care, if you're struggling with stress, if you're struggling with other things, it's okay to reach out. And as I said, Insight is a wealth of knowledge, and we have a number of different avenues and consultations and support systems that we can help families with. I did see a question here, Steve, regarding the rapid test. We at Insight are not going to be using the rapid test. There's too many unanswered questions regarding the rapid test at this point in time. The PCR test seems to be the more accurate, if you will, test. And we all have to keep in mind that if somebody has had an exposure, it takes 5 to 7 days for that virus to actually incubate in your body to actually get a true positive test. So if you fly across to California, you come back tomorrow, and then you want it to test, you have to wait 5 to 7 days. And so really trying to get an understanding of what kind of beast that we're dealing with, because it really is a beast. is really important for folks at this point in time. And so I would say reach out and ask questions, and ask people what their protocols are. Insight has been totally transparent. I know we wash our participants' hands every hour on the hour. It sounds ridiculous, but that's one way we can keep people safe. High touch points frequently, things like that, that we can, things we have control of.
Great. And thank you, Anita. And Justin, you got a few closing remarks and that you'd like to share?
Sure. I think I lost my video, but thanks again, Steve, for running this program for us and giving us the opportunity to really talk about our unique situation in our different entities. Now, I'd like to close out with maybe one thing, and it's talking about pre-COVID, and COVID's really put us in a situation where I think all of us sort of self-isolated and try to figure out what we wanted to do or what was going to happen next. Especially in the senior population, not having that constant contact or getting out of the community. I think pre-COVID, up to 40% of people with a diagnosis of dementia suffer from depression. And with that being said, moving into a community or tapping into a resource is better than sitting at home wondering what's going to happen next. As you touched on earlier, there's so many resources out there. Just pick up the phone. Somebody at one of these communities, especially at Lansdowne Heights, will point you in the right direction, even if it's not with us. There are a lot of programs out there that can support our caregivers, that can support our potential residents and people that are suffering with dementia or any other type of ailment. But waiting for something to happen and waiting for a fall or a crisis is not the solution. I think there's so much out there that we can be proactive, that you can tap in, that are 100% free, that we're just willing and waiting to help out in any way possible.
Great.
Thank you guys again.
Great. And we'll send out a recording so you can share this with everyone and follow up. And I want to thank the panel members and the attendees. And I think this was a really valuable discussion today. So enjoy the rest of your day, and we'll be talking to you soon.
Thank you so much.
You bet.
Thanks, Steve.
Okay, bye-bye.